Good morning. I welcome you all to this satellite workshop on the network of neglected and diseases and zoonoses, which is a part of the ITM thematic networks. And I invite all the participants this morning to this satellite meeting. I'm sure we'll have more participants joining us very soon, but due to the we have a long day's program, we would like to start. At the outset, I would like to briefly introduce my co-chair. He's Professor Hamid Sahibi. He's from the Hassan Institute of Agronomy and Veterinary Sciences in Morocco. Just to give you a brief idea about this network was created almost 6 years ago as part of the Framework 3 agreement between Institute of Tropical Medicine and the Belgian Development Corporation. And we have many institutes from Asia, Africa, and also from Latin America. The coordinator of the network at the present is, as most of you would have communicated, is Severin Thijs, and the promoters of the network are Professor Marlene Boulard and Dr. Tankwe Marcotti from the Institute of Tropical Medicine. Now, I would like to invite my co-chair to say a few words.
Okay, thank you, Professor Suman. I would also like to thank everybody here and thank mainly Professor Marlene and Dr. Severin Thijs, future doctor, for all the work and for the great job that she did, and welcome you to this session. Thank you very much.
Thank you, Professor Hamidi. I think it would be nice if all of us introduce ourselves, because we are not too many of us. So could we start from the left-hand corner there, please? We need a mic.
Good morning, everyone. My name is Anita Michel. I'm from the Faculty of Veterinary Science, University of Pretoria in South Africa.
Good morning. I'm Professor Koos Koetser from the Faculty of Veterinary Science, Deputy Dean, and very welcome.
Good morning. My name is Freddy Proaño. I'm coming from the Central University of Ecuador.
Good morning, I'm Tanguy Marcotti. I used to work at the Institute of Tropical Medicine, and I was part of this network on neglected zoonoses.
I'm Shamal Roy from Indian Institute of Chemical Biology, Calcutta.
Thank you. I am Obukari Abdurazak. I'm from the University of Niamey, Niger. Thank you.
Good morning. I am Itagal Tarafa from Haramaya University, College of Veterinary Medicine, Ethiopia.
Good morning. I'm Dr. Victor Manakasare. I work for the Copperbelt University School of Medicine, Ndola, Zambia.
Hello, good morning. I'm Pushkar Pal from Nepal, and I work at Agriculture and Forestry University. Currently, I'm working on antimicrobial resistance and vector-borne zoonoses.
Good morning, I'm Marlene Boulard from the Institute of Tropical Medicine in Antwerp.
Good morning all, I'm Severin Thijs from the Institute of Tropical Medicine. Thank you for everybody to be there today.
Good morning, my name is María Eugenia Toledo from the Tropical Medicine Institute Pedro Curie in Cuba.
Good morning, my name is Jorge Perez. I am the director of the Tropical Medicine Institute in Havana, Cuba.
Good morning, my name is Francisco Duran from Tropical Medicine of Cuba, Pedro Curie.
Good morning, my name is Herman Sogo
from Burkina Faso.
Good morning. Myself Paritosh Malvi from Banaras Hindu University.
Good morning. My name is David Hendricks. I used to work at the Institute of Tropical Medicine, where I used to fulfill Severin's current role, and I'm currently doing a PhD in the Tellson Institute for Child Health Research in Australia.
Good morning, everybody. Manish Kakkar from Public Health Foundation of India.
Good morning. My name is Braulio Valencia, and I'm from Peru, from Institute of Tropical Medicine, Alexander von Humboldt.
Good morning. My name is Crispin Lumbala. I'm coming from Democratic Republic of Congo. I'm the Director of National Program Against Sleeping Sickness.
Good morning. My name is Jan Koen from the Institute of Tropical Medicine, Antwerp.
Good morning. My name is Marianne Pirar. I'm also from the Tropical Institute of Medicine in Antwerp.
Good morning. I'm Chitwambi Makungu. I'm from the University of Zambia, Faculty of Veterinary Medicine.
Good morning, everybody. I'm Narendras Bhattrai. I'm from BP Kerala Institute of Health Sciences, Naran, Nepal. Thank you very much.
Good morning. I'm Dr. Kanika Korala from BPKIHS, Dharan.
Good morning. I am Vishnu Joshi. I work in Annapurna Neurological Institute and Allied Science, Kathmandu. My research is on neurocystic
Good morning. My name is Francisca Mayanti. I'm from Center for Tropical Medicine, Faculty of Medicine, Gadjah Mada University, Indonesia. Thank you.
Thank you very much. As you know, when this network was created about 6 years ago, there was a thematic change in the way we wanted it to function, more to have focus on a South-South collaboration. And the network over this last 6 years has been conducting and supporting activities, mainly research and other collaborative activities to stimulate and also to support South-South and even triangular collaborative work. So I would like to, and Severine has conducted in the last month or so, she's been sending out emails to us many times, reminding us to fill out those online surveys, and she's now going to present to us her results of this survey. So we would like to hear from Severine what people have experienced and what do they want. Thank you.
Thank you, Suman. I will. Yeah. Thank you. Okay. All right. So indeed, I know we are at the end of those 6 years, but just to remind also the historical frame of our networks, it used to be, in fact, 2 different networks. So for the beginning, 6 years ago, the Animal Health Department started a strategic network on zoonotic disease called One Health Networks. And then the Public Health Department created and started a strategic network on neglected disease. 3 years after, because also of the changes among the structure of the Institute of Tropical Medicine, we decided to merge the 2 networks, and in fact it was quite relevant if we were talking about One Health to join and make it only one. So that has been, so the new name of the networks changed in neglected disease and zoonoses. So the survey online was just focused on those 3 last years, so when the network merged, so from 2011 up to now. So at the end of this month, of December, we will go in another phase of this network. But first, so that was the right timing to evaluate and see what we have done and accomplished and what we can do for the next round. So the objective of this survey was to evaluate the FA2, the FA3 made the part 2, and then preparing the FA4 and to see how we can utilize, we can use those 3 next years, because it will be a transitional period of time of 3 years before getting to the FA4. Well, it's a bit complicated, but the idea was to see and evaluate a bit the network from 2011. So we did the survey online because we thought it was most easier, as you are all from different parts of the world. So it was a questionnaire with closed and open-ended questions. The link was sent to our mailing list, which is about 100 people. The structure of the questionnaire was divided in 4 parts. First, the member's profile, their identification, what kind of support they received, so the reporting a bit of what kind of support we provided and how it was utilized. And then the former activities, so a bit part of evaluation of how you think it was done. And then what you are looking for the next activities. This online survey was made via this software online, the formsite.com. It was opened the 11th of October, and 28 people fill it in. So it's 1/3 of the members of the mailing list that I sent around. So it's quite, I think, representative of what maybe all the members thought. And I'm sorry about that. I thought that the questionnaire will be for about 15 minutes, but apparently the timing that it took you was 30 minutes. But it's good because I really see that you really take time to do it, and I really, especially for the open questions, you were really talkative, and it was really interesting for us. So thank you very much for you who participate to this survey. So the first part about the title, so what kind of people answered. So most of the people were postdocs. Then you had professors and misters, so no grade. And then PhD students, and one person was a master student. The professions around was mostly our medical doctors and veterinarians, one social scientist, and in fact, it was people, biologists or parasitologists, people working in public health, epidemiologists, and biotechnologists. The disease studied among the members is quite small, but it was mainly soil-transmitted ailments, then leishmaniasis, and another big group of disease studied was teniososis, cysticercosis, schistosomiasis, and sleeping sickness. There were also in the others, I thought it was interesting, they mentioned yaws, onchocerciasis, leprosy, and dracunculosis, who didn't receive any tick. So my question is, are there more neglected disease among the neglected disease? So we can think about it after all. And then on which aspect survey participants are working on, it's mainly on the epidemiology aspect. I also wanted to see if people stick to more than one disease, and apparently most of people are focusing on one disease only, 14, and then 6 on 2 diseases, and then 3 people on 3 diseases, etc., and then it goes a bit down. So my question is, for disease control, do we need specialists? So people who are focusing only on one disease, or more generalists? That can be also a question raised for later on. Now the second part of the survey was on the SNNDZ support. So how people learn first about this network. Mainly it was from colleagues and supervisors. So it's more the mouse to hear situation. Then you had mostly also from the ITM colloquium. It's true that the 3 colloquium that we made in Lima and then in South Africa and today here, we always have had a network meetings, so it's maybe from that the people learn about it. And then you have also from other research projects and from ITM websites, so it's quite interesting. So that's how you learn about it. The kind of support that you receive, mainly it was for travel grants. That's what you receive more than research grants, and a very few on methodology support apparently. And then which year what the most active period was apparently 2013, so the last year. It's maybe because we were at the end and so we had to finish all our activities, but also in 2011 when we merged. Which kind of support did you receive? Apparently, we don't see well. The color changed, but it was the international conference. So it was travel grants to participate to international conference and congress. What the events were, for example, the 6th European Congress on Tropical Medicine and International Health in Barcelona, I think. Also the World Lesh Congress of the 5th of it, the ITM colloquium for sure, and then also the joint colloquium on where medics and vets joined forces in 2010 in Antwerp. About workshops, it was the one on qualitative research methods, and also somebody received help to participate to a GCP training in Cambodia. So it's quite a bit of everything, but so mainly it was for international conference. Just to note that I wanted to know if people receive more than once support from the network. Apparently most of you were receive only one, and 6 participants received 2 times the support, and 1 received already 3 times. It was just not to, it was just, I thought it was interesting to see if we were, and it's nice to know that a lot of people are being able to be supported. So now the third part about the evaluation of the network activities. We mainly focused on 4 themes. So the source of exchange, as mentioned by Suman, the One Health approach, the qualitative research, and the young researcher's career. So did you think that it was a good idea? Apparently, it's mostly the young researcher support that you think, you strongly agree that it's something that was really a good idea. And the last one was the South Exchange, where that's the only team where we received 2 disagreement. So it's interesting that maybe it's a sign that you are not ready, or we were too much pushing in it. But well, that's the result of the survey. We can discuss after all. Then was it well addressed? Apparently, for most of them, yes. The young researchers was the one who received the more, apparently the well more addressed agreement. And then the qualitative research, apparently that's it's mostly yes, but that's the one who were not enough supported or not well addressed. That's interesting because, yeah, for me, I know how I have to work on that. Then, do we have to continue on those 4 thematics? Apparently, yes. But if we see more in details, it's just the South Exchange that really is not the one who you seem to be pushing it, but mostly, yes. Now about the website, because it's also the frame where we can share, because we are from all over the place in the world. How many times per month the website is visited? The average is 2 times per month. That's quite good. The minimum is 0, and the maximum was 15 times. I suppose that sometimes you must be, when a call is open, that must be more and more visited than another time of the year. But so we have an ID. Do you think that is a functional website? For most of you, is yes. So that's good. But then I wanted to go more in details. Do you think that additional information must be added? So in general, you mentioned that we have to announce more opportunities, so grants, so that's grants for traveling or for research. Also information on all other funding agencies, calls for collaboration in joint research and training program, and also postdoc opportunities. That's interesting. Then you want that this website is really a forum to exchange on different NTD topics among different disciplines, but also among different partners, among other networks maybe. And you want that we have a better list of the group working that you know who is working on the same area as you. Like this, you can more exchange on those issues if you are challenged by your research or results. Then you ask for more updates, and you mentioned that it can be an idea to have a regular, like kind of newsletter, or even an alert system which can be updated and mentioning, oh, don't forget to look at the website, new information are coming out. Updates on ongoing research activities from the network, and that's also what was raised a lot. So you want to know what people are doing and how they are evaluating in their career, and that you can follow also what they are doing. And then general updates of the network and events that we are organizing, etc. And then you also ask to have more posts about, for example, published manuscripts of the members themselves, not especially from, like this, we can share articles that you published, and that's quite a good idea. So about about information that you want that we keep in the website, it's for sure the calls and sponsorships available, the big grants or the opportunities linked to infectious disease and trainings. Update information on topics related to control on neglected disease, zoonotic disease, etc. News about the network or other event, or activities more specifically. International events, so the calendar must be updated on time. Recent and relevant publications. Name of ongoing research project and investigators supported by the network. The reports of previous meetings. Like this, if you couldn't attend it, you can have a feedback and follow how the network is evolving. The resources and links to the proceeding of conference directly. Like this one, for example, and also the results that the network obtained through the research grant. You really like also to have linkage among young researchers more, like the idea of forum is coming there back. You want to keep that, and then also new teams of research that is interesting to keep there. Then it's good but taking care of a website is quite a lot of jobs. So my idea was to know if you were willing to feed the website, and apparently yes. Well, 8 people say depending on what, but 6 on how often. But mainly, you said yes. 9 people said yes. So that's really good news. And thanks to the names, I can go and see if you. Go personally to you and ask if you can help. But anyhow, it's really nice, and it's really good news. And how often you are willing to participate, mostly it's once per month. It can be also once each semester or once a year, but it's less. But once a week, indeed, it's nobody answered that. It's a bit too much. And on what you want to contribute on the website. It's, for example, to share information on your own research. Like this, we can follow what you are doing. Also, apparently, a lot of you want more information on visceral leishmaniasis in the biology aspect and vaccine development, Burley ulcer, zoonoses, and NTD. So it's more on topics related. You are willing to share publication and research findings. You are willing to highlight our activities. So if you are following a research grant to feed on what you are doing and how far you are, and etc. And also somebody said whatever is needed is welcome to ask. So the last part of the survey was the way forward. So I was asking what kind of challenges on NTDs and zoonoses you are facing for your own research or in your institute. Most of you mentioned the fund shortage and insufficient adequate funding possibilities at the appropriate time. That's important, that it's also sometimes it comes too late if we want really to do something in comparison to other major diseases as HIV, tuberculosis, and malaria. You asked if the challenge will be, and you mentioned a lot, intersectoral collaboration, so the One Health approach. For you, there is really a problem that medics don't want to collaborate with vets. It was mentioned a lot. And also other intersectoral collaboration, also met with environmentalists and agriculture people, etc. Then other challenges was the lack of specialized training opportunities and capacity building for young scientific research. So they think that in the way forward it can be a challenge. And then they mentioned, for example, training on lab methods, specifically on NTDs and zoonotic disease, statistical tools, analysis of project work, and also, and it's interesting, how to design new research projects, also capacity building on research itself, and then on technical expertise. There is more practical, but apparently challenges will be the availability of diagnostic facilities and tools, but also drugs, treatment, and consumables, but related to neglected disease in the field, because some of the communities are difficult to access. So it was more practically, but it's also important to have in mind. And then also the estimation of the disease burden is difficult because of the lack of reporting of the cases and the lack of coordination and monitoring at different levels in the country. Then also, it was a long list. You really were really talkative about that. That was the challenge about collaboration with ITM colleagues. Apparently, you are afraid that ITM is lacking interest in NTDs and zoonoses, and also collaboration with the North, because we are more and more mentioning South-South, and a challenge will be to collaborate still with the North. You have also, you are afraid of limited knowledge about disease in the community, so that was that more about the qualitative aspect of research and control disease, that you have different behaviors, different beliefs among the communities, and that the control measures are not really adapted. And here that was really specifically, but I wanted to mention it, a better understanding of underlying pathogenic mechanism. I'm not really knowledgeable about all that, but it was all about biomarkers of disease risk, therapeutic response, and prognosis and outcome of NTDs. And then it was another aspect, the disease control programs, that it sometimes is not well addressed in the country. The program people don't want to accept the ground reality, and so that's why you have a décalage between what the country is proposing and the reality. And then you are afraid that there is extreme focus on NTDs, but in limited number of fields only. That the lack of scientific journal where you can publish, and also how we can eradicate infectious disease. That's what the challenges that you see. So quite a long list and very interesting. Now, what expectation you have for the network? You want that we continue to be a source of funding for research, scholarships, the participation to meeting, workshop, training. So, and also easing funding for other programs and other grants. Create possibilities and advocate for more trans and interdisciplinary research collaboration between medics, vets, social scientists, and environmentalists. To continue to strengthening and build capacity for research, and especially for young researchers, but so technology transfer, improve the quality of laboratory in the south, support also courses in epidemiology, and also you ask training related with One Health. Then you also want more building capacity for disease control program. And then also to promote and strengthen the South-South collaboration, but also the cooperation between members. It was already mentioned. So if you you need assistance for something, you can ask to another colleagues from the network, and sharing all also scientific results and research program among members, not always coming from the network itself. You want increased networking among members. For you, it's important, organizing seminars, colloquium on NTDs. So advocate for NTDs still, and include also new research area, be more open. And then somebody mentioned for the website that it should be an educative and learning website. So how to answer your needs in the coming 6 years, according to you, but it was a comment from the survey, but just by addressing the expectations, so the list that I mentioned just before, but also supporting small grants on specific topics. So you are not looking for such big grants. Creating a strong collaborative hubs in disease endemic countries in various regions. You want that we target consortium level grants. You are asking for online open course on various aspects of MTDs. You need support to increase capacity for research on One Health concept and teams. And then that was also interesting point to I don't know, to find new research areas that can offer applicable options for control of NTDs and critical information from the public health perspective. And the example mentioned was the pathogen determinants of disease as human determinants, genetics, social, etc. So yes, to be more open to new and receive more public health perspective. Then helping alumni also to continue to participate in international conference. And then somebody want that we include animal trypanosomiasis in the disease that we can target. So thank you for your listening and for the training. I don't know if you have, if we go for question now, if you have questions, a clarification, and I'm willing to do it. Yeah.
I want to know if this network, how is this network was successful to gather people, vets and physicians and biologists. Thank you. Because I think if we, in my mind, if we want to talk about One Health, and this sectorial collaboration which is needed to eradicate disease, we need these people to be together and work together. And do you think that the network was successful to help in this way?
Yeah, up to now, I don't think so. Also because all the grants offered was mainly institutional, and so it was on the same topic. And I think we can maybe think about research grants where it's not a exchange between institutions, but maybe an exchange between disciplines, and that can be the requirement to apply for a grant. Is that the proposal must be multidisciplinary? But up to now, it's true we didn't do it. But there are also many other ways. But that's the first thing that I've got in mind, and that I think we have to go for it if we really want to create interdisciplinarity. Because by ourselves, it's difficult to go and knock at the door of another discipline and see, because it's taking much more time than if you are among, your peers and you know how your methods are functioning and what objective you have. But if you are including other disciplines, it's making much more challenges. Yeah, Katia?
Does it work? Yeah. You said that people were not in favor of South-South collaboration. So I was just wondering, was there a reason given, or it was just said no, or less interested in the other topics?
Yeah, it was less interested than other topics. So I don't think they are really against, not at all. And I can't speak to all the members of the network because it was only 28 people. But it was not, according to the other topic, it was less mentioned. My idea is maybe because it was too early or we were too much pushing on that. But we can ask we had for example, Morocco and Nepal work on a study together, and maybe you can give just a few words on if you think it was worth it, or I suppose that yes, but maybe we can see that with the poster after all. But yeah, that's my point of view, that it was too early, but there are a few research going on a South-South exchange basis, and that's the occasion to see if it was worth it and how we can improve it, or how we can more create those exchanges.
Can I just make my personal experience is, you see, what I see is when we want to do some work, we always look at our disease which we are interested in. And for us, for example, for myself, like leishmaniasis, and one of the criteria for application of the grant was we collaborate with institutes with similar interest. And it may be so happen that in the other institutes in, say, some other country may not have the same disease profile. And so maybe we need to expand the dimension of collaboration for accepting South-South collaborations beyond diseases. For example, there was a proposal for, I think it was for good clinical practice, laboratory practice. I mean, just an example. Maybe there could be some other cross-cutting, disease cross-cutting issues, which would, generate interest in both the institutes to collaborate. So I think this is something which we need to look at this stage, because we had a very limited number of institutes in the current network. So maybe finding the right institute with the same disease interest was a problem.
Yeah, okay. Good point. Oh, yeah?
Thank you very much for this presentation. And I speak in French?
Yeah, you can.
Ok. Excusez-moi, je suis plutôt francophone. Mais je suis... vous allez traduire? Ok. Donc, le résultat que vous avez présenté correspond vraiment à nos attentes vis-à-vis de cette network. Mais quand je regarde le taux de participation des personnes qui ont répondu. Et à mon sens, de notre côté, disons, les gens qui sont souvent sur le terrain, c'est un problème lié à la connexion, souvent Internet. C'est très intéressant et je crois que le nombre de participants aurait pu être en tout cas plus élevé. Ce que je suggère, c'est qu'au niveau de certains pays, qu'il y ait des points focaux qui peuvent recevoir des questionnaires et les transmettre par d'autres voies aux personnes, aux membres intéressés pour qu'il y ait plus de réponses. Donc je pense que ça peut être utile dans les endroits où l'Internet n'est pas toujours accessible. L'autre aspect qui est... Oui, d'accord.
So the first point that it's Bukhari, yes, that our colleague Bukhari from Niger, yes, is making is that he's very interested by the survey, and the message that you gave corresponds to what he was expecting. So the low participation rate caught his attention. This 30% response rate you got, and he says that you should not underestimate the poor internet connections and the accessibility of internet for people like him who are in the field, and that is not easy. And he makes a suggestion that if, in case you would repeat a similar exercise in the future, that you might provide some other way, a mechanism with a focal point in countries, people who can actually relay the information in another way to their colleagues in the country who don't have regular access.
L'autre commentaire que j'ai, c'est par rapport aux réponses. Les personnes qui travaillent sur 1, 2 ou 3 maladies ou 4. Donc, je pense que c'est très intéressant. En tout cas, au niveau de nos pays, je crois que c'est important de travailler sur plus qu'une maladie, parce que généralement, quand vous prenez les maladies, ne sont pas... Il y a vraiment de ces problèmes de co-infection, de complications. C'est très compliqué, mais en même temps, on n'a pas assez de chercheurs, de pointus, pour travailler convenablement sur une. Donc, le problème, c'est comme vous l'avez souligné, réellement qu'il y ait une véritable intégration entre le médecin et le vétérinaire qui pose sérieusement des problèmes.
Okay, so he was also reflecting on the response you got about the question how many diseases people are working on. So 1, 2 or 3 diseases or more. So most of the people in the survey replied that they worked only on a single disease in their research. So Bukhari says that in our countries, he says, you have to work on more than one disease. He suggested it's better to work on more than one, and for several reasons. The first reason being is that these diseases occur in patterns of co-infection, and in very complex patterns, actually. So it is interesting to work on more than one pathogen. The second reason is that there is this lack of scientists, and that having people more polyvalent is a good thing. So he also puts emphasis on what you said, that you said that the doctors don't want to collaborate with the veterinarians. That was a reply in the survey, and he agrees with that point, that it is very difficult to work in an integrated way.
Le dernier point que je vais, excusez-moi, de soulever, c'est très intéressant, c'est un peu la collaboration sud-sud qui est ressortie. Et là aussi, c'est très intéressant. Quand vous prenez un pays comme le Niger, un pays sahélien, où l'élevage est transhumant, les travaux que nous avons effectués ont montré que c'est exactement les mêmes souches qui circulent au niveau de tous les pays. Et l'un des intérêts que nous avons eu à participer à ce genre d'atelier, c'est que ça nous a permis, par exemple, lors de l'atelier qui s'est tenu à Johannesburg, la fois dernière, d'être en contact avec des chercheurs du Nigeria, du Burkina, du Tchad, que nous n'avons jamais pu rencontrer ailleurs, et pouvoir échanger et mettre au point des bases de collaboration réelle. Donc je pense que au-delà de cet aspect international qui regroupe tous les pays pratiquement du monde qui sont représentés ici, ça nous a permis d'avoir une réelle intégration sous-régionale pour qu'il y ait un contrôle plus efficace. Ça, c'est un intérêt majeur que je tiens vraiment à souligner et merci beaucoup.
Okay, so last comment he would like to make is with regard to the South-South collaboration. So he thinks it's very important. And he makes the point with reference to the meeting that was held in Johannesburg, the previous colloquium, that was really a point in time, well, it was a real opportunity and a good opportunity for him because he could meet colleagues from Nigeria, Burkina, Chad, and it was the start of a more international exchange about a problem he was working on, which is the cattle raising in patterns of transhumance, which I can't translate, but Tanguy might find. Of course, how do you say that in English? Cattle élevage en transhumance? Well, pastoralism, pastoralism. Nomadic pastoralism, this is the term. And that is definitely cross-border in the Sahel. So he found that the same species was circulating, and that is important to look at it in a cross-border way. And so I think, well, that's my own comment. That is a nice result, I think, of the colloquium in Pretoria. That he says that thanks to that meeting, he actually established contacts with colleagues to address that point in a cross-border way, if I translate it well. Yes.
And the other good point is that it can be sub-regional. It's not necessary to be indeed, because the disease are not the same from another country. So if it's regional, it's maybe easier to create a South-South exchange. I think it will be the last comment because we have.
Well, thank you for your presentation, Severin. Yes, according to your survey, medics are not going to collaborate with vets. On contrary, it has become very necessary to work together to eradicate or to eliminate the diseases of genetic importance. There are several, more than 760 diseases have origin in animal sources. So what do you think, would the strategic network be able to unite the both forces?
Yeah, we are trying for a while. I think we have all together, because it's easy to say, oh, they don't want to participate with the vets, etc. I think now we have to really tackle what are the issues and propose something. And there are many initiatives that are going on, and I think also the training, if you can include in the curriculum of the medical doctors and also in the veterinarian medicine, a part of One Health, but how and etc. It's difficult, and we are trying with at ITM to see how we can merge and include that in the curriculum of both of the masters. But if you are from the beginning already sensibilized to those issues, it will be easier than when you get to the point to do research in the field. Well, that's one way. How to promote it in the network that we can see more concretely. But indeed, it's for me. My idea is for the next few years. It's a bit to discuss this, not specifically this issue, but how postgraduates, also masters, can can include that how we can do, and I know that in South Africa, in the University of Pretoria, they're also trying to create something on One Health. But yeah, we are working on, and we have to see how it goes. But there are some bases and that are some grounds fertilized that are growing up. But it takes time. The mentality change, the behaviors of people, it's always a challenge.
Thank you very much, Severin. I think we should move on. And again, I think Marlene, Marlene is going to now present on, as you know, we have going to complete the Framework Agreement 3, the second half this year. And we have to now make another proposal for the next 3 years. And Marlene and Severin, they have got together and made this proposal in, with consultation with other partners. And I would request Marlene to make this presentation. I think all of us have received a copy of this presentation also. So, thank you. So Marlene, please could you start now?
Yes, thank you so much. Okay, first of all, as Severin said, thank you for all your input in the survey. When I listened to your recommendations, it was clear that there are very concrete ones which we can take up, like work on the website, definitely we will do an effort. But there are other ones that we know we should actually bring together and look for ways how collectively we can, one of the recommendations was target large consortia for big projects. That's how I understood the recommendation. Definitely the budget of this network is not very large and does not allow to fund large research consortia. But what we can do together is exploit the fact that together we are stronger, knowing each other, knowing the strong points of all the partners may allow us to go for collective research grant, to build a larger research consortium. And actually, we have done so, I think, through the network, actually. We managed to have one large Framework 7 funding from the European Union, in which, well, there are European partners involved. There are 13 partners all in all. So some of the results are presented this afternoon in the poster session by Francisca Meyanti and Kanika Koirala. So they will talk about the NIDIAF project, and there will also be a poster in the poster session tomorrow in the colloquium. It's after tomorrow. So that is an example of how collectively we can develop strong research proposals and actually win these highly competitive research funds. But it's only one. This takes a lot of energy, and it doesn't include all the partners at the same time. But these are definitely things I can take away. So we thought that it was a good idea to look at what has been submitted for the next framework agreement. So the colleagues who are sitting here from the partner institutions, that you have each your own institutional collaboration proposal. That's one. And there is, of course, this network proposal, which comes additional on the ICs for the partner institutes. Now, what is the status? Jan Koenen is sitting here, and he can give you more information if you would like to ask him specific questions. What I can tell you globally is that the proposal has been submitted to the administration in Brussels, including our network proposal. So it passed all the validity checks in Antwerp, and it has been integrated in the big program. So we are now waiting for the feedback from the administration in Brussels. And this is due in a few weeks. There is a meeting scheduled, so currently the people in Brussels, the civil servants of the development cooperation, are reading this proposal, and we are waiting for their feedback. We have, well, good hope that our proposal will be accepted. There might be minor changes, but you will be informed as soon as we have the news. Severin will send out an email to all of you. So let me, you can see, for sake of transparency, we have made copies, so you can look for yourself what is there. It is the usual introduction. I'm not going over that in detail. So we described a little bit the process. And basically, you could ask yourself on the process, why didn't you do the survey before you submitted the proposal? That is a very legitimate remark. But that's how it is. We had built on feedback we got last year, on feedback, on discussions we had with the chairs of the network, and we have tried to integrate. Because we were asked by our people coordinating this program to work for the sake of continuity. So not to make drastic changes. And people who want to know the reasons for that can ask Jan. So there are no drastic changes in the network. The activities you will see, the results to be achieved, they are more or less in line with what was there. That's why we didn't want to disturb everybody with big consultation and stakeholders and development things. But what we learned through the feedback in the survey, we will take it up, definitely. And it will help us also to really reflect on what comes after this, because these 3 years, they are a transitional period. And if we want to, it's not, I can say we, but if especially you think that this network is legitimate and is needed, then we will have to think very hard and to make a very good case why it needs to be included in a framework 4 agreement. So thinking ahead, because Severin talked about 6 years, okay? But 6 years from now, that means the 3 years, so this text is the proposal for the next 3 years, but we should anticipate on what comes after. And what comes after is a big question mark, a framework agreement 4, yes? It will be for all the institutions, for all the networks. It will be, a big challenge to really make a good case for what you want to propose, why, and why this is contributing to your goal of building institutional capacity or improving neglected disease control. So that's for my introduction on the context of this. So Jan Koenen is here and he can correct me anytime. So I have learned from him that logical frameworks, they are flexible. They are a tool to be effective in our work. And we use them as a board, as a compass to guide our work. So we can, after 1 year, we can make adaptations. In a way, we can, if you have very good reasons, explain why we stop one activity, why we add another activity, sometimes even at result level. So that's why I feel free to say that we will take into account your feedback in the survey as far as we can in the current transitional period of 3 years. And definitely it will help us, I think, collectively to come up with maybe more drastic proposal for a framework 4 agreement. So, okay, I'm talking a lot. I skipped the introduction because you know all the facts, or you can read what was put together there. Coming to On what page is it, Severin? Because then I can go quicker. It's 19. Oh, but anyway, I'll try something else. Oh no, that's not a good idea. Oh, my God. We said we don't make a PowerPoint, we just work with the document, but yeah. Okay, let me go ahead once again. Yeah, here. Point 4 is a brief overview of what we did in the past period. And I don't know, there are some new people here, so they have learned already through our introduction what was done. So we have now an operational network, and we promised that we would be more vocal together on the subject of NTD and zoonosis control. Now, the first point, yes, we have an operational network. The proof is you are here, and we did quite a number of things. Are we really vocal? We tried at the time with David, when he was coordinating, to have a few viewpoints and a few papers out collectively with the network, but I think it stayed at that level. We could try to become more visible, possibly through that website that Severin was commenting on. We have definitely organized 3 meetings, 3 colloquia, 3 scientific meetings, and these medics and vet joint forces. So result number 2, which we promised, was to address knowledge gaps and priorities for improved control of NTD. And there were activities like the workshop on burden of disease, organized by our veterinary colleagues, was by Nicolas Praat and Tanguy. In 2009, there was the qualitative research and mixed method workshop and other things. Sorry. Number 3 was the dissemination of our findings. The 3 ITM colloquia, the papers on research priorities for NTD control, the one written after the Lima meeting. Unfortunately, Anita is here, and Tanguy reminded me that actually in Pretoria we had a stakeholders consultation workshop sponsored by EU, and the report of that one is still pending. So that is, the reasons for that is that it was very hard to pinpoint a few clear priorities for research on zoonosis, because the results of the workshop was a long list of priorities and not a short list. It was hard to make a good case for a few research priorities. So, well, maybe you are entitled to say, maybe, don't waste such opportunities, because there was a clear request from EU to write a text. And Tanguy just reminded us that, yes, we can look back at this draft, and we can maybe combine some of what came out of the survey here in terms of priorities for capacity building and edit, try to combine and to write something up. That is not a firm commitment, but a promise that we will look again at how can we produce collectively some output on these topics. Okay, there was another workshop in Morocco in 2012. Now, the interesting thing and what you are waiting to hear is, what about the next 3 years? So the title of the project is there. So I am on page 8, and you see the title. You see the project purpose. You see a list of countries, and you might wonder, why is Niger not there? Because Bukhari can ask that. So the countries which are here are the countries that, in fact, the partners who were present in a joint partner meeting several years back, and who formally adhered to the network, who filled out a form, and we keep that. David gathered all that information. So these are the network partners that at that time said that they wanted to adhere. But we may revise this, and I can issue, on behalf of the chairs as well, we discussed that. I can issue an invitation if there are institutions present here that would like to adhere as an institutional member to our network or an affiliated institution. So please inform Séverine, and she will write down your institute's name, and we need a focal point in your institute. Because in our network, as you understand, we have two types of membership. We have institutional membership and individual membership, and both are most needed and most welcome. The institutions are listed because this is money coming from the Belgian corporation, and as you see, we have some resources that we can allocate through calls or through our collective priorities. Now, that allocation of money, we make contracts with institutions. And we have some criteria sometimes on countries that are eligible and others that are not. So we prefer to distinguish. We have institutions, institutional membership. They will also vote on the governance. So the two chairs you see here, they are representing actually their institution and so on. But individual membership is most welcome as well. And individual membership, they are given access to all information, and we share all information on opportunities, calls, and so with all the individual members of the network. So the other stuff, so this is our budget for the 3 years. So yeah, it's not huge, but we try to use that to our best extent. Okay, again a list of all the people. Actually, several people are here. Professor Gotuzzo apologizes. He really wanted to come, but is not available to other commitments. Okay, my God, you must get bored. So where are these logical frameworks? Ah, here, they come, yeah. I'll stop with the summary sheet, because that's easier to project. So this is now for the next 3 years. You will recognize 3 results that have been formulated. Number 1 is the network itself is operational and vocal, so that result is still there. So to make it alive, this network, definitely we will invest more in the website, that is sure. To be vocal, to formulate opinion papers, statements, that I would like to hear your suggestions, and in the discussion afterwards, if you have any suggestions, please do so. And don't necessarily wait for the chairs and for us in Antwerp to take the initiative there. You are most welcome to take the lead on such thing. Result number 2 is knowledge gaps and priorities for improved control of NTD and zoonoses are identified and addressed. This is the same. And result number 3 has slightly changed in a way that now we are specific about qualitative research. Capacity for qualitative research in the network has been augmented. Why is that? It was already there. When David coordinated the network at that time, he invested a lot in capacity building on qualitative research methods. So there were workshops, there were actually in the European project NIDIAC I was mentioning, there is a full work package on this type of work. And we are working along the same lines. So I think thematically speaking, the One Health concept and the qualitative research, these are good things we were doing and we want to continue, we want to strengthen them. So then you have a long list of activities. For result 1, it's manage the network mechanisms for a change, define strategic priorities, it's what we're doing now, and joint participation in international scientific and policy forums. So this is basically money for meetings, money for workshops, money for websites, the first result. The second result, you see 3 activities. The first one, a yearly competitive call for implementation research project on neglected tropical diseases and zoonoses targeting junior scientists. The South-South exchange is still there. We heard some discussion about it. I would not say, well, two people disagreed, many people agreed, and Bukhari made a strong statement in support. So, but we understood that the way it, from Suman, that the way it was organized was very complex, made it hard, and there might be more flexible ways to encourage collaborative work between network members. And number 3 is something Séverine mentioned, is examining on the One Health concept. It was an idea she came up with, and we discussed that with the chairs. We said, why is this One Health concept so difficult, and what can be done to promote it? How can we overcome that? And well, I had a medical training long ago, so why are it the medics that are resistant to invitations by veterinary colleagues? Personally, I have no resistance at all to work with veterinary colleagues. I think they, with my experience, they bring a lot. But I can see that maybe some of the medical doctors don't see that yet. And one of the reasons might be that during their undergraduate training, they have not been really confronted with zoonotic disease challenges. That could be that's a hypothesis. So that is something that Séverine suggested we could explore, but collectively. She would very much like to involve you in that type of research, to see how, and you please give your feedback on this and discuss this with her later if we don't have enough time. Or would you like to explain a little bit more about this? She will come back on this afternoon. Okay. Number 3 is the capacity building on qualitative research. So what is foreseen, what is available is without any cost. We have a full-time coordinator for this network, Séverine Thers, and she is a social scientist, an anthropologist, so she is available for ad hoc support for any of your questions in this field. So, and she is not alone. She has her own cluster of colleagues at ITM, but also abroad. For instance, there is a group of people in Congo trained to work on qualitative methods. And not only there, in Nepal, there are several colleagues in several countries that have been trained in qualitative research methods, and she can put you in contact with them. So ad hoc methodological support is possible. And the plan would be to organize at least one training workshop on qualitative research methods in the larger One Health domain. So when we say One Health is transdisciplinary work on neglected tropical disease and zoonoses. So once again, we have listed 13 partners, but additional partners are welcome if working in the domain, as I said. And the main criteria, and yeah, that is not by coincidence, you strongly confirm that also in this survey, that this network should focus on young scientists, on junior scientists in the institutes who do not have access to the large grants yet, but who need to grow and who can benefit from smaller grants. So we will see this afternoon in the poster session the result of some of the smaller grant work that took place. Okay, I think I'm through. Is that okay, Séverine, or should I go? Yeah, we have, for those who are new, our governance, as we are a large group, there's a list of institutions, but there are 100 individual members, more than 100. So how do we work on a day-to-day basis? Well, we have chairs, elected chairs, and they form the more or less steering group of this network together with the coordinator Severin and the promoters in Antwerp. So Pierre Dorny is replacing Tanguy Marcotti for the veterinary side, and I will continue for the medical side. For the chairs, as Suman will explain, they had a mandate of 2 years that now comes to an end of 2013. And Suman will explain how the election will be organized for the next 3 years. So the post of chair is open for re-election. So we are looking for candidates. So that will be a point later on, after we have finished this discussion. So I think that's all, and it's probably better if you ask questions to the four of us. Is that okay? Is that okay, Mr. Chairman? So maybe we should sit with you.
Thank you. I think if there are any further comments or questions to Marlene before we move to the next agenda.
Yeah. Hello. Yeah. No? Just to be more precise about the activities and the research grants, we can still discuss about it, but the idea this time was to organize it by bigger grants that will be during 3 years. So the idea was to organize as soon as possible a call, and 3 projects or proposal will be selected, and it will be during 3 years. Because we noticed that short or small grants is good, but it was in time frame very short to get the ethical clearance, to get the contract done, and then to start really the field work. So the idea was to have less grants, but with much more money, and doing it during 3 years. So the idea was to have 10,000 grants per year for a project, so 3,000 grants in total, and then it will normally be 3 big projects. But it's still something that we can discuss if you feel that it's not a good way to do it.
So we were looking for simplicity, lean management. In a sense, that was the major reason. But from the survey results, there we got some indication that you actually prefer more grants and smaller grants. Yeah. But anyway, any thought would be welcome. Huh? So.
Severin, just to make it more clear to everybody, what is the type of, in the next 3 years, so there will be 3 grants of 10,000 each.
So the call will be launched, I hope, in January, and then 3 winners will have the possibility to have a research for 3 years and get in total 10,000 euro for each year to do their...
For each year?
For each year.
Right. And beyond, other than these grants, what are the other activities which members should look forward to?
There will be some workshops, 1 per year, about 20,000 grants, euro. And then I think small part can be allowed to travel grants, but that was what we planned. But I see that most of the money were used the past years in travel grants for attending conferences and congresses. So we can still see how it goes, but mainly it was the idea to have bigger grants and last and let people have time to do it and really come back with something that we can then publish and etc. But it's really open to discussion.
Yes, thank you. Any further comments on the presentation of the Framework 3.3 proposal, or questions for clarifications? Yes.
Yes, thank you, Professor. My question is on why is the focus on young scientists? Rather, why can't it be, say, established scientists with a condition that there's an inclusion of young scientists so that the young scientists can learn from established scientists?
Well, I think the reason why we had thought that we would give a priority to the young scientists is because, you see, the established scientists, we are not giving very large sums of funds. And the established scientists are usually already having other projects for them to do their work. So this was something like to encourage young scientists to get an exposure so that they can also, gradually move up the ladder, get the confidence. So basically it was to try to stimulate young scientists to be more involved in research also.
I think most of the networks, they have this idea to push young scientists that are mainly institutional, related to institute or to place where they are working.
May I?
It is, as it was also shown in the survey, one of the things where most of the people agree on. But it's, of course, junior scientists, they work under supervision of promoters. So in the calls, there would always be a senior person committing to giving support to the juniors. That would always be there. But that is the way the partners have always expressed the need, where a network with such a small budget, where it can come in usefully. Because for established scientists, they might be looking for real competitive grants of a larger amount. And still, this proposal of what Séverine explained to review the funding mechanism to 3 times, so 3 proposals, each of 30,000 euro, that can be implemented over a time frame of 2.5 years. In practice, it will boil down to that. Now, that proposal goes a little bit against that spirit of promoting as many junior scientists as possible. And it was, honestly, it is there because we were looking for more easy and simple management. But, so it's for reasons of contract management in Antwerp. In our project managers, they have to establish a separate contract for each of these proposals. So there is a lot of transaction cost in establishing these things. But that is why Jan is here, and he will confirm that is not something cast in stone. If you prefer to keep it to small grants of 5,000 euro each, that we can issue 2 times over the period, so be it. And then we will follow the advice. And I think after the discussion here, the steering committee will have to decide on this. So again, open to your suggestions.
Yeah, Marlene, what I felt actually, basically, during some of my work, I felt that some of the technologies that I don't have. And I was thinking of doing some on speciation of antimonial, trivalent, pentavalent, but I don't have that expertise or something like that. But I know somebody else is doing this kind of work on speciation of antimonials. But if we can send some of our students to different laboratories to do that kind of stuff, so some fund, it's not a big money is required for those kind of work, maybe 1,000, 2,000, 3,000 euros. And student can go to that lab and do that work and come back, and so kind of PhD students or postdoc So if you can allot some amount of money on this kind of exchange program, it's not a big money is required. Maybe 50,000 euro will serve the purpose. So I would rather suggest that this kind of exchange of students in the different laboratories is will be useful for networking.
Actually, that was also there in the last framework. It was already there. So I think this will also continue to have such type of small grant supports for travel to another institute to learn some technique and come back. It's there. Yes, please continue.
Thank you, Professor Bola. Answer to my question, because she knows that I will ask that question, but it's very interesting for me to have a little comment on it. So I will say it in French. C'est vraiment très pertinent pour nous. Et je vais rebondir sur ce qu'a dit mon collègue tout à l'heure. L'intérêt de participer à ce genre à ce projet-là, parce que vous disiez que le Niger ne faisait pas partie, je vais parler, parce que nous avons, si je prends l'exemple, moi, je suis le premier Nigérien qui a fait une thèse sur les maladies infectieuses, les zoonoses. Actuellement, après moi, nous avons 7 étudiants, dont 5 sont en Belgique. Et les 5 sont même sur le budget national. Donc nous avons fait en sorte de déclencher un intérêt général pour que les gens se forment. Et ce qui est intéressant. À côté de ça, nous avons pu accumuler... Yes.
Bukhari says that he explains that, okay, I said that Niger was not on the list, but he explains that he was the first in Niger to make a PhD thesis on the neglected zoonoses. So he was the first. But today there are 7 others, colleagues, or there are 7. You are 7 or there are 7 juniors?
7 students.
7 junior students. And 5 of them are currently studying in Belgium, with sponsorships from the Nigerian government, the government from Niger,
Oui.
not the Nigerian.
Oui,
yeah.
Tout à fait. Donc c'est pour parler de l'intérêt que cela suppose pour les jeunes chercheurs, l'encouragement des jeunes chercheurs. Et des fois, ce n'est vraiment pas une grosse enveloppe de bourse dont on a besoin, c'est juste des soutiens logistiques. Par exemple, actuellement, nous avons, chez moi au Niger, j'ai fait une collection de plus de 7000 sérums. 7000 simples sérums, dont je voulais les transporter pour les analyser ailleurs, mais je n'ai pas le moyen, ni de stockage, ni de transport. Donc, j'ai l'aval du CERVA en Belgique pour qu'on puisse travailler sur ces sérums-là et faire des publications, mais on n'a pas le moyen de pouvoir les transporter, par exemple. Et ça, c'est souvent de petites sommes qui sont nécessaires pour, au niveau terrain, au niveau collecte, au niveau transport. Merci beaucoup.
So he actually wants to make a point that in line with what Shaimel Roy said, that in his position in Niger, to work in this domain, because for the lack of research funding available to his institution, it are usually bottlenecks of this kind, of a small amount of budget. For instance, he gives the example that he has now in his serum bank of 7,000 samples, and that he has everything arranged to have them analyzed, and there are protocols, everything is arranged, except for what is crucially lacking is the funds for the logistics, for the transport of the samples, if I understood well. And so he said that flexible funds like this type fill a gap in his day-to-day reality, in his institutional environment.
Thank you.
Can I just make a couple of comments? I think 10,000 euros is 30,000 in total is quite a lot of money. It's a big grant, you know. First of all, I would like to know if these grants will be allocated to young scientists that are busy developing their careers. For example, must they be enrolled for a master's or a PhD, or can it be flexible on its own? The scientists apply for the money without supervision of the research. And I agree with the previous speaker that perhaps smaller money amounts will be, you know, for a particular purpose, will just help that candidate, at least from where I'm coming from, to, you know, to further their careers, because I think that's the ultimate purpose, is to support young scientists to build their research career, either through qualifications or other means. So I think flexible money, and perhaps more flexible and having more grants, I know it's more administration for the institution, will be more meaningful to build a broader base amongst young scientists.
Thank you.
May I invite Jan to make a comment, Jan Koenen, because I think the amount of transaction cost we have in project management, establishing separate contracts for each single initiative we take, maybe we should try to find other solutions in Antwerp. Maybe we can just add the institutional budgets with a small amount, or anyway, I don't know. It's just a question to Jan. I don't know whether that's possible.
Yeah, it's not impossible to do it. But yeah, how would I say it? It's an administrative question, and I think it goes beyond what we are discussing here. Because in the end, you could say, why would you have a network if you want just to raise all the institutional budgets? So and that would only apply for those projects where those countries where we're working with an institutional program, and not for the others, because there are a few here with whom we don't have a country program or institutional program. So it will only be a solution for part of the projects. But okay, I can take it up there and see what we can do. But I prefer to have the strategic network as a project with its own budget and with its own rules, let's say, and the same rules for everybody.
But it is something that I take the opportunity to explain, that this issue of we cannot just make a wire transfer of money to a bank account somewhere. We need to establish a contract for this, and that is yeah. We can try to find administrative solutions, but this contract takes time, and we have had several times, as Séverine said, the process from call to contract simply takes too long. For instance, there is now a Congolese colleague who has been awarded a grant to be spent within 2013, but yeah, it's almost over 2013, and the money is definitely not there. So how we try? Well, anyway, logistic difficulties is our worry and not your worry, but please be aware, and we will try our best to reduce the delay.
But what is good to know is that if a small amount for you, it's good. It can be a small amount that you can use for 3 years. Then it will also be less work for administrative reason. That can be also a solution. Smaller amounts for more people, but for more time.
Okay. So that is what we can do, of course, to have a call early on. So early on next year. So it's a proposal, early on next year, where, of course, if we have only one call and we have it early, then we can allow that people take 2 years to implement the work, or as long as it is before end of 2017, but that we have a report. We need a scientific report from the work before the end of 2017. So we can do that. So we can issue, well, go for the possibility of more grants to be spent over a larger period. Yes, Jan?
It's the end of 2016. 14, 15, 16, 3 years. Okay.
Yes, thank you. Yes, last comment, please.
The point that Marlene raised in terms of where there's no institutional arrangement, can you perhaps then, to an individual youngster, can you arrange it through your institutional agreements, countries? For example, if we've got an agreement with you and there's somebody applying where you haven't got an institutional arrangement, I think it's possible to arrange those financial things through the institutions on a regional basis.
It's really something to take up with Jan. Definitely for people belonging to institutions where we have an established collaboration, it should be easier, no, to establish something. But anyway, we'll discuss. It's a point for us to work on. We need to.
Yes, thank you. I think we've had very fruitful discussions and suggestions, comments, and I thank all of you for providing such comments because, as Marlene mentioned, this framework agreement, there is also scope to modify as per the needs of the network partners and other partners. So these many things have been taken on board, and we will try to accommodate all the suggestions. And also we need to find some solutions from the administrative side of things, but that should not be a deterrent to fulfill some of our needs. I think after this presentation of, we have one more small item to announce, and that doesn't require a lot of discussions, I think, at this stage. As has been mentioned, that in this network we've had a steering committee, and we've had 2 chairs, which is a rotatory chair and which has been elected from amongst the members of this network. So our mandate is over by the end of this year in 2013. So we need to appoint 2 new chairpersons. And the process which we would like to follow is, firstly, Severin, who is coordinating the network, is going to send out information before sometime in December for people to send their votes, and also to Marlene also. Oh, Severin, yes, yeah. You are the election commissioner, I think. Yes. So now, there may be a confusion because some of you who are here are not a part of the network. So I think you need to also, if your institute wants to be part of the network, I think we need to have an application also sent before you can be considered for as a candidate or as to vote for this elections. So I think this is the best is when you will get the information from Severin through email. There are more details of how the process will work. So this is the announcement I would like to make, and I think I'll pass the mic to my colleague to say. Oh yes. The most important thing is the candidates should contact directly to Severin if they are interested to be chairperson for the next. And this is not going to be for 2 years. We will have it for the 3 years, right up to the end of 2016. Please.
So if you are interested to take over Professor Sahibi, Professor Rijal, to be more involved and to maybe put your ID more through the network, if you want to be candidates, you can contact me now or during the colloquium, but I would like to go back home with the name of candidates. Thank you.
Excuse me, Marlene. Yeah?
Does it work? Yes, it works. So, before you close the morning session, maybe one last point. I want to thank formally both of you for having done this job for 2 years. We had Pascal Utumba being the chair for 2 years, and Professor Gotuzo starting this. So thank you for our nice collaboration, and we will, as Severin said, we will share. We don't want to make this a very bureaucratic network. But the purpose, what we are looking for, is a network that is dynamic and that responds to your needs. So one of the things is also that it should be not driven by an Antwerp secretariat or depending on our momentum and dynamism or lack of dynamism in Antwerp. So that is for the next chairs. Definitely we are looking forward that they could become catalysts of this network. So I told Sahib, I told Hamid, and Suman that they are most welcome to reapply. We should put together what are the rules for this network, and we don't have a set of rules yet, but I said we don't need a very long list of rules. If we agree that we work with institutional membership and individual membership, and that it is a simple adherence by just telling the coordinator that you want to adhere, I think that will do. On the voting rights, we have to put it on paper, as Suman asked, and we'll do that. We will work that with the current steering committee, and we will inform it. But the voting is by the institutional members, one person being a focal point in each institution, adhering to the network. So if there are institutions present here or represented that would like to adhere and they are not yet adherent, please also inform Severin. So as this is important and I don't want to rush it, is there any comment or question on these issues? You can still, during lunchtime, talk about this. Please feel free. We will break for lunch. We have time up to 1:30. What is that correct? 1:30? Yes, because I don't trust myself with figures anymore. So 1:30, and we will reconvene in this room for the scientific session. So we will start at 1:30 sharp, and please be there. Because we will start by listening to our junior colleagues, the ones who have prepared presentations of their work in the small grant scheme. So thank you.
Thank you, Marlene. I want to thank you, Marlene, and Severin for all the work that you have done, Professor Suman, and I think that this is one of the best network I have participated. And that's true, because it gathered people from different areas, and I mean, most objective was to have this collaboration, sectorial collaboration, and I think that is mostly achieved. And it is a very educative network, because we have a storm of emails from Severin every day, and every day it's new things, new ideas. So it was I mean, pretty good to work together with this team. I think everybody here to be in here. And we close this session, this morning session, and we'll see you at 1:30 after lunch. Thank you very much.